A revolution is quietly brewing in Australian healthcare. It's something that could completely change how we treat disease, maybe forever. We're talking about a move away from one-size-fits-all approach to medicine that is tailored, literally, to you. And it's all thanks to the power of genomics. So, how are we going to pull this off? Okay, before we dive deep into the science, let's just start with a really personal question. Imagine there's a test that could predict your risk of getting a serious illness down the road, giving you this incredible power to act early. But what if that exact same information could be used against you, like to deny you life insurance? Now, this isn't some sci-fi scenario. It's a very real fear that has been a major roadblock to a medical revolution. And this wasn't just a vague worry people had. This concern about so-called genetic discrimination has been a huge barrier. We've seen major studies from places like Monash University confirming that this fear actually stops people from getting clinical genetic tests and, just as importantly, from participating in crucial medical research. Just think about that for a second. The very tool that could unlock new cures was being left on the shelf all because of fear. Well, thankfully, the government has stepped in to tackle this fear head-on. In late 2025, they introduced the Treasury Laws Amendment Bill. And honestly, this is a massive game changer. It basically makes it illegal for life insurers to use your predictive genetic test results when they're assessing your application. This single piece of legislation is the key, the absolute foundation for unlocking the public trust we need for this next wave of medical innovation. And with that trust in place, we can finally hit the accelerator on a complete shift in how we do medicine. We're moving away from the old way, right? Where your treatment is based on your general symptoms. And we're moving to the new way, precision medicine. This means treatments can be tailored to your unique genetic makeup to prevent, diagnose, and treat diseases way more effectively than ever before. But look, a change this big, this fundamental, doesn't just happen on its own. It needs a conductor for the orchestra, It needs a single organization to bring together all the brilliant work being done by researchers and doctors and policymakers and get them all playing from the same sheet of music. And that brings us to Genomics Australia. Launched on July 1st, 2025, this is the brand new national body tasked with leading this charge. Its whole mission is to weave genomics into the very fabric of the Australian health system, to turn that promise of personalized medicine into a reality for everyone. So what's actually on their to-do list? Well, it's a big one. They're going to be the ones tackling the tough ethical questions, providing expert advice to the government, and actually putting national policy into action. They'll also be Australia's voice on the global stage, helping all of us understand this new technology, and basically acting as the central hub connecting this entire new ecosystem. And this isn't just talk. They're putting serious money where their mouth is. The government has committed over $500 million to genomics research through the Medical Research Future Fund. That is a massive investment in our scientific future. And over $30 million of that is going directly to Genomics Australia, just to get them up and running for their first 4 years. Now, any great project needs a blueprint, right? A master plan. For Genomics Australia, that blueprint is the National Health Genomics Policy Framework. This is the official document, the national strategy that lays out the government's priorities and guides every single action they take. And this whole framework is built on 4 key pillars. First, putting people, you, your family, your community, right at the heart of healthcare. Second, creating a system that can actually adapt and grow. Third, and this is a big one, making sure all this incredibly sensitive genetic data is kept safe and secure. And fourth, a dedicated focus on Aboriginal and Torres Strait Islander-led genomics, which is so crucial we're going to circle back to it in just a moment. One of the biggest challenges here is the data itself. For years, all this valuable genomic data has been fragmented, stored in different places with different rules. It's like having a whole country full of disconnected local roads. To really unlock its potential, we need to build a national data highway. And this new data highway is what experts call a data commons. Just think of it as a secure, shared digital space where all those different roads of genomic information can finally connect. This lets researchers see the big picture, spotting patterns and making discoveries that would be totally impossible if the data was just stuck in separate silos. The project that's actually building this data highway is called Guardians. Its mission is to create the digital backbone for all genomics research in Australia. So it's building a national storage facility, creating secure on-ramps for researchers, supporting the major data sets, and making sure our traffic rules align with global standards so we can collaborate with the rest of the world.
Okay, so policy and infrastructure are all well and good. But what does this actually mean for people, for real families? Well, let's look at the Zero Childhood Cancer Program. As Professor Michelle Haber puts it, this Australian program is truly, genuinely world leading in using precision medicine to help kids with cancer.
And the results? They're just staggering. For kids with high-risk cancer, this approach has more than doubled their 2-year survival rate. Let that sink in for a second. That's not just a statistic. Those are children's lives being saved. And this brings us right back to where we started. World-leading research like the Zero program, it completely depends on people trusting the system enough to participate in the first place. That ban on insurers using genetic tests, that is the key that unlocks the trust, that allows this incredible science to accelerate and save even more lives. But for this revolution to be a true success, its benefits have to be available to everyone. Equity can't be an afterthought. It has to be woven into the very fabric of this national strategy. And the commitment to equity is explicit. The fourth strategic priority is entirely dedicated to ensuring genomics is led by and for Aboriginal and Torres Strait Islander people. This means co-designing culturally safe care and, critically, supporting what's known as Indigenous data sovereignty. And that's the fundamental right of First Nations people to control the collection, ownership, and use of their own data. So there you have it. We've gone from one person's fear about a genetic test all the way to a coordinated, well-funded national strategy. By building trust, creating the right infrastructure, and putting people at the center of it all, Genomics Australia is orchestrating this fundamental shift from reactive, generalized treatment to proactive, personalized healthcare. Of course, the journey is really just beginning. We are gaining this incredible ability to read the most fundamental instruction manual of human life. The story of what we actually do with that knowledge, well, that's still being written. So the question for all of us is, what kind of future are we going to choose to write?